Thank you for being here.
Thank you.
If we haven't met, I'm David Hefner. I am your Executive Vice President for Clinical Affairs, as well as your CEO for the Medical Center and for Medical Associates. And joining me is my partner in crime.
Absolutely. Good morning. I'm Gretchen Kaufman, Executive Vice President for Academic Affairs and Provost. Thank you for being here.
And we really do appreciate it. Look, it may not be a full auditorium, but this is the important people. So we're going to run through what's been happening the past quarter to give you a sense of the happenings exactly. And as you can see from our slide, excellence begins with our great people. You're part of those great people, and then we also highlighted some of the other great people and what is occurring inside our enterprise so that we can share that with you. Again, it's not everything that's happening, but it does give you a snapshot of some of those activities. So one of them is Lady Antebellum. They put on a concert and they raised probably $15,000 for us. We haven't gotten the final tally, but on behalf of the kids, they dedicated a couple of their concerts to that purpose, and they have over the past 3 years. So really a great showing of support there, as well as other community support, fundraising for the Children's Medical Center through Children's Miracle Network and many other avenues, businesses and individuals stepping up to contribute to that. And then all that gets rolled up into other great forms of philanthropic community support, which you can see is an amazing total of $43 million for this past fiscal year. Never happened before in this community. The most that's been raised, I believe, in any 1 year is $8 million. So this is just a breakthrough result that is an accomplishment for you and your colleagues and many others. Susan Barkus, leading the development team, has done a great job here. You can see it comes in many forms, which we'll touch on throughout the presentation, but overall, again, a breakthrough result. Other forms of this, Chris Bonham in the top picture there raised $6,000, teaching himself to dance, Dancing with the Stars locally, put himself on the line, did a great job to raise money for Alzheimer's. And then we're using some of those funds and others to support the respiratory therapy asthma camp. That gives you an example of, as we fundraise, what are different things that we do with this. And we've also done a giveaway Healthy Grandparents program through the College of Nursing to pack bags for our grandparents and kids in the area to support those who are less fortunate. And then just another form of our great people entertaining ourselves in the community here in the auditorium last month, where they put on a noon concert. Very talented people we have in our enterprise. The hospital celebrated National Hospital Week by serving ice cream to, probably about 800 people who came through the line of our employee base. So we had Gretchen and myself and others actually scooping up ice cream to serve it. But again, they were very low portions, and all the ice cream was low fat or sherbet.
Very healthy ice cream.
All healthy ice cream. Yeah, exactly. And then we have 3 slides just touching on great accomplishments that people are being recognized for across the nation. I'm not going to read these to you, but thought that if you could just take a moment and look at them, just really outstanding accomplishments and recognitions locally and across the nation. So there are 3. Here are another 3. And another 3. I just wanted to highlight on the bottom Dr. Rao, again, our leader in gastroenterology and digestive health, being featured in a 50-year-old magazine, as he too is 50 years old. So when the magazine started, he was born, and now he's featured in it. And then here's a few slides of people that are stepping up, again, double hatting themselves, taking on new accountabilities. in different ways. So Dr. Smith taking on the deanship of the College of Graduate Studies. Dr. Why do I blank on her name? Lefebvre, stepping up to be the vice dean of the College of Dental Medicine. And then Jim Rush becoming our chief integrity officer. Mr. Smith taking on accountabilities in medical associates to be the VP and chief operating officer. Mr. Dameron, those of you who know him, has served in many different capacities. He's taken on being our chief financial officer for the medical center. Dr. Nussbaum, who's been our chair of ophthalmology, is also taking on being the medical director for ambulatory care, working with Joe Thornton on re-engineering all of our processes in the ambulatory care space. And then Dr. Tay is taking on being the chair of the Department of Endodontics. So again, great people, team members stepping up, take on new accountabilities. Mr. Braun joined us from the outside from University of Delaware and also University of Maryland Health System, so he has both experience in higher ed as well as health systems to be our Vice President of Communications and Marketing. Dr. Hill has stepped into the role of pediatric dentistry as the chair, and then Dr. McCall has come in from Wake Forest as the chair of psychiatry there to be our chair of psychiatry here. So great talent stepping up and taking on those accountabilities. Also, we, as part of our education, we have our talented allied health and nursing professionals stepping in to take care of people in the community through health screenings. So an example here of where they treated, let's say, 400 people in South Carolina as part of their education process. Great example where education and patient care are coming together. And then our Office of Diversity and Inclusion sponsored the Asian Pacific Heritage Month, and they did some races out on the lake. Anybody here participate in that? Very good. We have 2. You were on the second place team out of 20 teams, right? Great job. And we heard that you practiced many, many, many hours for that event. Did we get that right?
Like, no.
You had one practice right before you did the event, right? And we were second out of 20 teams, but a great way of demonstrating diversity and inclusion in action and having fun. So really a great day is what I hear. We weren't there, but we got the results in photos. Research and education, let me have Dr. Kaufman speak to those.
Thank you. As always, there are many, many good things going on in our research and educational arenas. We only have time to highlight just a few. One of the first that you may have seen in other venues, perhaps even on TV, there was a short spot during the Olympics, advertising this and garnering support from our community and elsewhere, is our institutional and enterprise commitment to public and preventive health. And so let's roll this little video.
She might have a longer life if she lived in Florida, Connecticut, or Costa Rica. He's more likely to become obese because he lives in Georgia. She's at a higher risk of hepatitis, AIDS, and other infectious diseases because she lives in Georgia. For many, these are shocking facts. For others, simply the reality of living here. To address these critical issues, Georgia Health Sciences University is launching an Institute for Public and Preventive Health. Together, we can find real-world solutions and uncover resource-preserving preventive measures. Georgia Health Sciences University has unique strengths and responsibilities in developing clinical services and biomedical research responsive to community health needs. As community and business leaders, you have your own strengths to offer. Take a stand, Georgia. She and others like her need your help today. The Institute of Public and Preventive Health, investing in a healthier Georgia and improving the health of Georgians and the world for today, tomorrow, and the future.
So this is in many ways a very sobering message, because the fact is we are standing in a county that's among the worst of the 157, in a state that is among the worst for public health outcomes, healthy America outcomes and measures, and we have a lot of work to do. We have much to be proud of, and this institute actually builds on the wonderful work that has occurred now for 30 years with the Georgia Prevention Institute and other researchers and clinicians throughout our enterprise. But the fact is there's lots and lots more to be done as a community, as a state, and as a nation in this arena. And we really are proud to be part of this growing initiative and focus in this institution. Among some other things, much in that same vein as David showed you a lot of sort of headshots and words, don't want to belabor a lot of these, but the fact is we did just take a little bit of a helping, a few servings of the different great things that are going on in the research arena, and they do highlight some of these as well as other types of initiatives, not just public and preventive health, but some of the other things that we have expertise in and our great faculty and researchers and have identified as important things to address. You see here some continuing support from the National Cancer Institute for our growing clinical trials sector, which is very important to us as we build out the cancer enterprise. Also in research aimed at helping to treat Parkinson's disease, again focusing on our neuroscience sort of enterprise and research focus. Again, some of the work that goes on with Martha Tingen and her group and others that relates to how not only tobacco use in individuals, but also those who are around them and exposed to that, either environmentally or just societally, what that predicts for them later on in their life. Some, again, sort of neuroscience sort of thing, actually, visual really, is studies to go on to help make our soldiers better able to escape detection, as well as to make them better able to break camouflage of enemies, kind of a sobering topic, but necessary in our war theaters, and very interesting work. Again, the idea of how to manage the effects of chronic exposure, chemicals that could be used in warfare, but also pesticides and other things are coming into play. There also is an interesting study with some outcomes that will lead to better treatment modalities for individuals undergoing stroke in their very post-stroke interval, in that fair percentage of them, regardless of their initial or presenting diabetic state, actually do have high blood glucose levels immediately after stroke, and that recognition can lead to some early interventions that may help prevent or at least lessen their brain damage. Some ideas about how to use submicroscopic beads to deliver both gene therapy as well as other sorts of drug delivery. I think we're all aware of the idea that high fiber is one of the things we should be sure is in our diet to a great extent. This study was actually picked up by a number of the news outlets throughout the nation and highlighted because it actually does show the adolescents' diet and how low fiber diet impacts their really predicted health throughout the rest of their lives as well. I'm going to take up meditation someday because I'm pretty sure I need it. In this case, it's showing that teens who meditate twice a day, in fact, then decrease their risk of cardiovascular disease. So the kinds of things that we all should be involved in terms of preventive health care and not waiting until the problem itself develops. And there's a very devastating congenital anomaly that scientists here have now actually identified the gene responsible for that, which had not been known before. And finally, one that really looks at being able to predict the ability of multiple sclerosis individuals, afflicted individuals, to remain independent and continue to be able to drive, which of course is very important to them, but we also need to gauge that against the safety of the roads. In terms of education, it seems like a long time ago, but just a few months ago, we were ending an academic cycle with our commencement exercise. We were very pleased to have a Nobel laureate there, a renowned scientist, Dr. Farid Murad. And also we celebrated at that point the recipient of our Beard Award for Compassionate Care. We think that's sort of like the gold medal of all the student awards that are given out, and we do that at commencement. It happened to be a medical student, Katie Cook this year, medicine graduate, could be from allied health, nursing, or medicine, rotating. And we're always very impressed by how much our students are able to accomplish, not just in their studies and their excellence in academics, but also in the way that they engage with their patients and provide benefit to the community. Another aspect of our training, which really starts before the students are ever enrolled in some of our educational programs, is a summer activity called the STAR program. It's about 24 currently students who apply and are accepted into a program that runs for 10 weeks in the summer. It's a research program. They come from all over the state, various institutions as well as nationally, and spend time with our researchers, get turned on, we hope, to research, understand what it's like to actually be in a very highly productive, cutting-edge biomedical science research arena, and with the hope that they then, and they do, return to us as applicants for our programs later on. I want to mention just a minute about the consolidation. Not going to go into any of the furor around about the name and what it may be, but the fact is our consolidation is on track. There are many, many, many decisions and things that have to be done in order to consolidate successfully our two universities. And so we have literally hundreds of people, and some of them are in this room, that are spending a lot of time in addition to their regular full-time jobs to make this happen. Many people involved equally in numbers on the ASU campus coming together in work teams. We have about 75 now to 80 work teams or sub-work teams that are involved in doing everything from figuring out how to reconcile two IT software programs that don't talk to each other but need to across the new platform, to how faculty governance and shared governance should react, in a philosophical way. So all of that's going on. We are proceeding down this timeline where you see now in August, we're running very soon up against our first hard deadline, which is the submission of the prospectus for the substantive consolidation change to SACS, our accrediting body. We are well on track. We will deliver that as planned. It's in its final stages. And they will then, the Commission on Colleges will then review that. And during their December meeting, they will vote up or down that yes, we're ready to consolidate, or not. We're going to say yes, we are going to be ready. They will vote yes. And in that case, we will then have 30 days to enact that consolidation. Recognizing that many of the back office sort of processes will continue to run in parallel, some of the financial systems, some of the other things out throughout the fiscal year. There are legal as well as other practical reasons that will have to be the case in some instances. But the front door, the front porch, the public face to students, to employees, to faculty that may be seeking positions here, we will be one university as of January. And then that will continue, of course, we will effect that throughout the entire fabric of the organization throughout the coming months and years, really. Maybe do you want to mention a little bit about
Sure. This is an example of education from a different angle, where the campus in Brunswick teamed with the health system there, the Southeast Georgia Health System, where they invested, as you can see, $3 million to build out a simulation center. And it's really designed for both physicians, nurses, allied health professionals to have a real experience of both an office setting, ORs, ICUs, et cetera, all in one footprint. And the picture here is in the OR with the team that went in Thursday night for their open house. The blonde, if you could point to her, Dr. Kaufman, Dr. Martin, works out of Savannah, covers Brunswick also, and she's done a great job of bringing this to life and having our partnership that is extended across Georgia in this sector come alive. So this is a great example of training the next generation and also bonding to us in our missions. By the way, they want to put up the name Georgia Regents University and whatever our health system name will be as soon as possible, and we've told them, sorry, can't do that yet. Got to hold off till we finish the accreditation process, and also we have to figure out our other names and what we're going to use. But it's an example of where people are very eager to get moving with the branding.
And also an example of how we truly are a statewide institution, and our reach and penetration into communities goes far beyond this one. And so we really need to celebrate that and our great partnerships and the support that are being provided in those communities as well.
So let me say a few words about patient care and facilities. Show you what's happening in that arena. One of them was Blue Cross Blue Shield. Heard a lot of noise about that when we wear our provider hat. This was 10% of our patient care activities came through Blue Cross Blue Shield. As you know, very acrimonious, particularly with the reimbursement around physicians after 9 years of no rate increases. We did get it resolved, as you also know, although it got drowned out by things like the name. But I will say that the Blues were great to work with at the end when we extended 48 hours. Our team, working with their team, resolved the issues and actually came up with solutions that I would say move us much more towards the future than anybody else, because we could now put together physician, different kinds of incentives and quality measures tied to hospital quality measures and incentives. And we're in charge of our own destiny here for treating patients that are Blue Cross Blue Shield members for the next 3 years. So it gives us a great platform to work off of. Also, if you didn't see this, we have many physicians that were voted on by other physicians as recognized at the top of their game. So a very small percentage of physicians fit into this. And here are 15 of them. Here are the first 5. And here are the next 10 in their different fields of specialty. So another great acknowledgement of our physician colleagues being recognized across the nation. And then another subset in cancer, here are 4 that are being recognized also. So right here in your own backyard, inside our own team members, again, being acknowledged across the nation. ECMO, those of you who know about ECMO for our young children, infants who need this kind of oxygenation therapy, critical to sustain their life. And we have Dr. Maria here representing pediatrics. Great acknowledgement of the team there for this award, which is really international in nature, not just national. So great job here by the ECMO team. And the ECHO lab has been reaccredited for the next 3 years, another form of excellence and quality acknowledgement for the ECHO team. And cancer has been reaccredited by the Commission on Cancer that says, yes, we are doing well in the cancer front. And the different fields that they survey, you can see 7 of them, we had high commendation in there to recognize that we are superior in those aspects of cancer center care. Facilities, again, related to cancer, thought we'd highlight a couple of things, but first let's talk about the Ed Commons piece. And Dr. Kaufman, if you'd say a couple of words about that.
Yeah, just very quickly, many of you are probably aware of the Ed Commons story. It was originally planned as part of or partner to the new clinical dentistry building, which is a wonderful facility, but this building is actually essential to making good on our promise to increase not only the graduates in the dental school, but also in medicine, and we needed this classroom facility, large capacity facility in order to do that. It had been on the planning and on the capital list for the Board of Regents, the sort of ask or wish list, for a number of years, and it actually a year ago was basically DOA, as David had said in a previous one. It was aging out in terms of being on that list too long. Projects can only stay so long, and if they don't rise into a funding level, they're gone, and you have to reapply. And it really had not gained traction there. There was a commitment, significant commitment from Dr. Aziz and others here to redesign that building, to go back into a planning phase, downsize it somewhat in terms of the spend for it without sacrificing what we needed in the essential elements, and also to make a significant commitment to contributing to the total cost through philanthropy. And many people didn't really believe that that would be accomplished when that goal was originally set. It was, in fact. We did get it back on the list, not only on the list, but on the funded list. So the GO bonds have been sold. The check from the philanthropy has been delivered to the Georgia Finance Commission, and we are going to be breaking ground this fall to get into that building in about 18 months. So it really is a wonderful story of not only the commitment of the community and leaders and you all in terms of how to rally around a project like this, but also the commitment that the regents in the state have made, because this coming on the heels of the dental school building, which was the single largest capital project the Board of Regents had ever approved for funding. And as we'll talk in a minute, the Cancer Research Building, which also sort of got buried in all of the naming furor, really represents a tremendous commitment on the part of the regents as well as the state to the betterment of this institution and what we do, the good work we do throughout here and the state.
So heavy investment taking place. This is the other piece of that related to cancer. Just a sidebar for a moment. This is an aerial shot of in blue showing the different cancer areas, whether they're research or patient care, how they're scattered across campus. If you're a translational researcher, it's not very convenient to do patient care and research because you got to go from place to place. And more importantly, if you're a patient, you have to shuttle many different areas to receive your care for cancer. So if we thought for the next 8 to 10 years, could we consolidate that in a different way? What Dr. Kaufman was just referencing is the $45 million that the Board of Regents authorized to fund another cancer research building. But what's important about this is we could envision putting that across the street on 15th, move all the research from where it's occurring now into that building for cancer, which would consolidate that, and then bring in future years the patient care aspects of cancer to where the research is happening. That would free up space that we're currently using for other activities that we could backfill. So in a long line of dominoes, this is a very important step. And again, as Dr. Kaufman was saying, that this was authorized on top of the Ed Commons, on top of the College of Dental Medicine building in previous iterations. We are being heavily invested in by the state and the regents. So despite what you may think about the naming aspect, when you look at are people actually investing in us, the answer is yes. I think we ought to be very appreciative of that, because otherwise we can't fulfill the future that we are actually best organized to fulfill. So great example of how we can bring cancer together and make a difference in the state. Finances, word about that. Here's an enterprise snapshot of where monies come from, $1.2 billion overall. If you remember last year, it was 1.1 or just slightly less than that, so we are growing in different forms. We're getting a little bit bigger. But again, we ought to recognize that there are constant headwinds that are happening, both in the higher ed sector and in the patient care sector. This is the higher ed piece of that we're flagging up here. You know, the state's projections for sales tax revenue isn't hitting where they thought it would. On top of that, there's a big hole statewide for Medicaid of a projected $300 million that the state has to cure. They in turn have said to all the state agencies, including University System of Georgia, be prepared to take another haircut. So in turn, the USG leaders have asked Dr. Kaufman and others to prepare for a 3 to 5% reduction in the university sector. Maybe you could comment a little bit more about that.
And this just shows the university picture, the slice that would have been university, and that larger $1.2 billion. And that total revenue, and the reason the grants and contracts looks perhaps a little bloated compared to what you're used to thinking of in terms of sponsored research, is those include the contracts for the Georgia War Veterans as well as the Georgia Correctional Health Systems contract. So essentially it passes through the university's books in order to do the good work that goes on in those facilities. The point that we are looking at mainly here, though, is the state appropriations, and you see there about $129 million. It was slightly higher because of the other contributions when you look at the whole enterprise. And if we were looking at that 5 years ago, you would see that there was 28% more in there. So we've taken really, over time, significant cuts on the state appropriations that come to us for the regular just operating budget. All the capital projects and the good things we just talked about aside, the fact is the operating budgets continue to decline, to be reduced. We'll continue to ask to do more, but less expensively, more efficiently, and it's incumbent on all of us to find out how to do that, to figure out the ways. I know we're close to the bone. We're probably in the marrow, actually. There's no fat left in the budgets after all these years, but the fact is we've got to look for other ways to finance our operations through philanthropy, through other kind of means, more grants and contracts. We've got to look at every position that is vacated. It's a whole lot easier to look and less painful to look at a vacant position than it is to look at a person in a position. So every time there's a vacant position, we need to think long and hard about different ways, more efficient ways to do that, to assume cross responsibilities, as David always says, to double and triple hat people. We're all working really hard, and we appreciate that, but we've got to work our way and manage our way out of this, and we will. I'm still very positive about it, but we can't rely on the state. That is the bottom line for it.
Well, and if you extend this, look, these headwinds that are playing out, at least in this iteration through the state for higher ed, this isn't going away. What we're experiencing, don't personalize it. While it's happening to us, it's happening across the state, it's happening again in higher ed, it's happening in the healthcare space. We can't afford what we have been doing with ourselves, so we're going to have to rethink it for the whole state of Georgia. But what Georgia is experiencing is where our nation is, right? We have a big deficit in the nation that we are going to have to pay down one way or another. So all of these changes and headwinds are going to flow through our backyard over the next 10 to 20 years. So we have to be thinking about how do we continuously remold ourselves to meet those new conditions and get ahead of it rather than reacting to it. I think we've done a great job the past couple of years getting ahead of it, more so than a lot of people are, but it isn't going to stop. That's the underlying message.
And just another word, because some people may be saying, well, what will this picture look like when we consolidate and become Georgia Regents University? The Augusta State budget is about $75 million all in, and so that will certainly be aggregated into the new university's budget. They are experiencing and have the same directive for the cut, whatever it will be, 3 to 5%. So we are, together on both platforms managing our way out of that as best we can. But as you can see, there will be an additive, but not a significant add, because we are, as David showed in the first slide, a $1.2 and soon to be $1.3 billion enterprise all in.
I'm just thinking, Gretchen, that we design these town halls, they aren't designed to make you happy. They're designed to actually share the facts with you, because collectively, when you pull smart people together, we ought to be able to outthink and outmanage anybody else. That's the intention. So again, what we're saying isn't designed to make you unhappy either, but again, we do believe that sharing the fact base with you should be empowering in the long run.
We do celebrate all our wonderful people, but we do deal in reality as well, and we appreciate everybody doing that.
So one way that we started last year and we're progressing through this year and next year on the labor front through attrition and redeployments of different kinds, and we did have to do a reduction in force last year. We don't want to do that again. So how do we manage our attrition, which is probably 1,000 people a year retiring or taking a job somewhere else across the nation? Can we remodel and remold ourselves as that is happening? We've been doing it. We did better, really well in FY12 where we exceeded where we thought we would end up. So if we hold that, it flows into this year that we just started against a bigger target of 31 million, and we still have a gap of a couple $1 million to identify and implement. But the different colors are that we're actually managing this by saying, where is it happening? How should it happen? Is it happening? And as it's happening, does it actually show up in our general ledgers? So we're not just taking our own word for it that it's happening, we're tracking it. And then we need to keep doing that this year and next year, because overall our workforce has to be slimmer and has to be actually working smarter, not necessarily harder. But there also is a lot of work that has to get done, so we're trying to balance that as we work through it. On the supply chain side, so not just our labor side, but on the supply chain side, that which we pay outside vendors, we want to reduce that because we'd rather pay ourselves rather than external vendors. And we've been working at reducing that. Again, we just fell slightly short against our target last year, but great work there. It flows into this year, assuming we hold it out in the contracts that we renegotiated, et cetera, and leaves us with a gap of about 6 million against a growing target. So we have teams of people working on this. Some of you are part of that. How do we reduce our external spend and do that creatively? And then again, next year, we have an even higher target, so we got to do this again and again and again. We set this up last year. We're just sharing with you that we're making progress against that, but between labor and the supply chain, this is in fact how we're saving money that we're then reinvesting back in ourselves. It's tough work, but it does produce results like this. This is the view from the health system. It doesn't include the university books, but from the health system, which moves up and down very rapidly, and we have to keep a close eye on it. For the fiscal year that ended June, this is how to read this. The medical center did generate an operating margin of almost 22 million. We projected only 12, so we did much better than budget, and against the previous year, we did slightly better than that. We had projected a lower budget because, in fact, all those headwinds that are happening on the health system side, we thought would hold down our operating margin, when in fact we did better than projected. We took on those headwinds, did better there, and produced a result that was better than budget. On the physician side, it was lower. A large part of that is because we implemented the electronic health records in the outpatient sector, and we have charges that haven't moved through the system that we've collected. So while it shows lower here, it should be higher during this next fiscal year. Overall, again, we did better than budget and better than the previous year. We just need to continue doing this year over year with even bigger results. Just to share with you also at the same time, we're even providing more charity care of different kinds to our community. So this again is playing out in the larger landscape. More people coming to us that have less means, and we're absorbing that as well. 35 million, and you can see over time that's gone up from 14 million to 35. And we thought it'd also be useful to share with you, we're not alone in this phenomena. Our other nonprofit, not-for-profit colleague, university, hospitals or health systems also doing the same thing, where over time they've gone from 16 million up to 28 million. So the two not-for-profits, 63 million or 65 million in uncompensated charity care. And it still isn't enough, right? But it gives you a sense of what we're doing from a community benefit point of view. Shaping our future, just a reminder, we did the overarching piece of the strategic plan that resulted in the T2020 strategic priority document. There is an ASU component of that Dr. Kaufman and the teams are working to understand and synchronize in anticipation of the consolidation next year. But we are taking the work here and here from a health system point of view and bringing it into how do we think about this in research, education, and patient care for the health sciences. And that work will go through the end of probably December. Many of you are involved in this or will be involved in it, because then we need to take that work and share it with every department and unit so that you can craft your own strategic and tactical plans that are consistent with both the mission plans and the high-level plans, right? So this is a multi-year effort that we're not waiting for, but we directionally know where it's headed, so we're doing both implementation work as we're crafting future plans. And then of note, as we're reshaping our future, coming attraction for the medical center employees and medical associates employees, we're redesigning our own healthcare benefits. So if you think towards this fall open enrollment, it'll be a different kind of a health plan that we're setting up for ourselves, much more consumer-oriented, where you and I will have much more of a say about how we're spending our healthcare dollars. So that'll be a change that's coming towards us, and we're working with a team behind the scenes that will start sharing with more of that information this next month. Along with that, we're also going to bring, instead of shipping our meds off to Medco and receiving them in the mail, we're bringing that in-house because we can take advantage of some government pricing for ourselves that will give us a break on our own meds if we fill them here on campus. So that's mostly right off the bat for the medical center employees and medical associates. We'd like to extend at least this piece to all of the health sciences or university employees and ASU employees. Can't do that yet until we get agreement from USG, which we don't know if we'll have in the near term or not, but we're working on making that available. And then also coming towards us, we have many different events. Maybe Dr. Kaufman, you could share these 2 or 3 events with us.
Yeah, one of the first dates in the fall will be our second annual Diversity Summit. It was very well attended and well received last year, a great community as well as institutional event. This year we are very pleased to have as the featured speaker Soledad O'Brien. It will be a fun-filled day, though, with lots of various folks involved in it. So we would encourage you, there's a website link from the homepage to go on and register if you would like to attend that event. Again, it's both community and enterprise folks.
We were told in the last session that this is half booked already.
Already half capacity.
So if you want to attend, go to that link and register now.
It will be at the Kroc Center, as it was last year. Also, piggybacking onto that, we'll be kicking off this academic year's presidential lecture series with one of the participants in the Diversity Summit. Dr. Cruzado will also come and give a noontime presentation here, open to everyone. So related but not directly linked to the Diversity Summit event, but we are leveraging her presence here to hear her talk about her experiences as the first Hispanic woman president at a major university. So I think that'll be very interesting. Some other events that are going on, we continue, of course, to have lots of different platforms for continuing education and advanced training for our healthcare professionals. That highlights one of those, clinical use of CT. And our second annual symposium on advances in warrior care, relating specifically to our mission for an emphasis on rehabilitative and regenerative medicine. This is a partnership with Eisenhower as well as the VA, and particularly focused around warrior care, again, coming up later in the fall.
So with that, we're going to go to Q&A, although I think what I'm going to do is ask Dr. Kaufman if you'd head to the other town hall,
Since we're doing back to back to back here.
and I'll do the
That
Q&A.
sounds good. One of
But
the
it-
things I did want to say first, though, because we neglect
Please.
to do this, is I want to thank our partner in crime, Jack Evans, for always sticking with us and doing these. He, is largely responsible for helping us craft them and find the pictures and do that stuff, and we don't thank him enough for the good work he does behind the scenes and behind the podium.
Yes, let's thank Jack, please, thanks.
Yay.
And Jack, along with everybody else, we want your blood, right? Not only your great leadership, management, and everything else you bring to bear, but we also want your blood. We spend millions right now paying outside vendors for blood, that if you gave your blood, not only would you save lives, but it reduces our outside spend, which is like a supply chain savings. So you get a two-fer or a three-fer if you participate, so please do donate your blood. Okay, Q&A, couple of comments here before we turn it over to you. One of them is the time that it takes, and this includes Jack and the team's time to put together the materials, our time to prep, our time to lead these, doing it 3 times a year. It's a substantial investment. If it's not worth it, like if you don't get value out of this, we'll stop doing it. We need to hear from you, so please do go on to the web, leave your feedback for us there. What do we need to improve, or should we continue doing this or not? Let us know, because we do need that feedback. Otherwise, we're flying somewhat blind. So with that, excellence begins and ends with our great people